Hello, everyone, and welcome to Building Healthy, Equitable Communities, a new series from us at ChangeLab Solutions. This is a virtual space to explore the elements of a just community and the conditions that will help all children and families thrive. Over the next 6 months, we'll be releasing 6 collaborative episodes that offer training and discussion on how policy coupled with community power can advance health equity. You can see the full schedule here and on the series homepage. We wrapped up our kickoff episode a couple of weeks ago, which explored health equity as a principle and a practice. This episode provided a high-level theoretical framework for how to use law and policy to advance health equity. And in future episodes, including this one, we'll discuss how to apply this health equity framework to specific content areas. If you are wondering what exactly is in an episode, each episode contains 3 parts. First, there's a blog, which shares the consequences of laws and policies that don't take health equity into account and how we can respond to these. In this episode, we looked at 6 federal policies that fall short of their promise to support working families. Then we host a webinar that provides stories and innovations from leaders in the field, as well as resources to support your work on healthy change making. That's where we are today. And finally, we close each episode by moderating an expert panel. These equity innovators will be in conversation with each other as well as responding to your questions. You can join us next Tuesday, the 22nd, for a really amazing panel that I'm really excited about, featuring Marie Bug from Reaching Our Sisters Everywhere, Sharon Turman from Legal Aid at Work, Sherry Vawant from A Better Balance, and Yvette Sanchez-Fuentes from Child Care Aware of America. This panel will bring their diverse expertise to bear on this question of family supports and health equity. I will note here that we won't be doing Q&A at the end of this webinar, but instead we'll be deferring questions to that Ask the Expert session. That said, if you do have questions that come up today, you can go ahead and submit them through the chat box at the bottom left, and we will be sure to pass them on for Tuesday's session. And even if you can't attend, if you register, you'll receive a link to the recording. With that, I'll jump into the introductions. My name is Hannah Sheehy. I'm a Senior Policy Analyst at ChangeLab Solutions. I have a public health background, so I spend most of my time looking at connections between laws and policies and the public health evidence base that supports them, or in some cases does not support them. And I work a lot on our early childhood portfolio. Vicki Szabo is our guest speaker today. Vicki is the Vice President of Workplace Policies and Strategies at the National Partnership for Women and Families, which is based in Washington, D.C. Vicki's work includes paid family leave, paid sick leave, and workplace fairness. She has spearheaded efforts to advance paid family and medical leave and paid sick leave laws at the federal and state levels. We're really excited to have her with us. The agenda. So our goal today is to explore how paid family leave policies can support and strengthen low-income families and drive health equity. We'll look at what paid family leave has to do with health, why it's a health equity issue, and what makes a paid family leave policy equitable. Then Vicki will touch on how we can drive and sustain policy momentum at the state and federal levels. That'll be at the end, but she's actually also going to start us off by getting us all on the same page about just what kind of policies we're talking about, what the status quo looks like in terms of people's ability to take paid time off to care for themselves and for their families, and why these policies are so critical for gender, social, and economic justice in the workplace. So with that, Vicki, I will hand it off to you.
Thank you so much. And hello to everybody. It is wonderful to be here with ChangeLab, and a special thanks to Hannah and Sophia for their really amazing work putting this webinar together. As Hannah said, I am Vice President for Workplace Policies and Strategies at the National Partnership for Women and Families. The National Partnership is based in Washington, D.C., and we are a nonprofit, nonpartisan 501c3 advocacy group dedicated to promoting fairness in the workplace, access to quality health care, including reproductive and maternal health care, and policies that help all people meet the dual demands of work and family. We've been around for quite a while. We were founded in 1971 as the Women's Legal Defense Fund and have worked on both workplace and health policies for decades at the federal level. And our workplace policy work, as Hannah said, really does span across public policy venues, federal, state, and local, as well as leading a coalition of advocacy groups and working with private sector partners, participating in conducting and analyzing research and communications work. And we are really delighted to have ChangeLab more deeply engaged in this space and to think about the kinds of partnerships and alliances and work that can be done to lift up the public health case and the individual health case for better and more equitable leave policies, as well as the connection between health and economic security. And so I'm really excited to be able to share some of the background and framing today, and then really to have hear what Hannah has to say about digging in on the health pieces of the work. So where I'm going to start is with the Family and Medical Leave Act. Our organization has the FMLA in our DNA. We helped to write and pass this law, which is now 25 years old. We just celebrated the first anniversary, the 25th anniversary of this law, which was passed in 1993. And whenever somebody talks about the FMLA or their need for paid leave, it really comes down to stories. Whether it's Victoria, who's a mother from Michigan, who wrote to us about staples in her stomach and needing to go back to work with those staples 5 days after giving birth while her child was still in the NICU, or people who are involved in campaigns who have come forward with very serious personal stories about the impact of not being able to be there for a dying parent or an ill child, or foregoing the medical care that they needed to make sure that their own illness could be addressed. These are very tangible personal issues. We tend to think of them as very individual, person to person or employer and employee, but these are the need for leave, the need to provide time to care, the ability to be there for your baby's first smile or to hold the hand of a parent through chemotherapy or other treatment. These are things that are fundamental to human dignity, to health, to economic security, and they really do bind us all. They are not individual issues. So that sort of takes me to the policy landscape, and again, to FMLA and what it provides, which is 12 weeks of job-protected unpaid leave with continuation of health benefits. It covers about 60% of the workforce, and about 20 million workers take FMLA-type leaves each year. And they're taking it for a variety of reasons. We often see and hear stories about new parents, and obviously there's a huge health, moral, and economic case for new parents being able to take leave. But parental leave is actually only about 21% of Family and Medical Leave Act leaves each year. Another 18% is to care for a seriously ill parent, spouse, or child, and more than half, about 55%, are for personal medical leave. And so as we're thinking about the types of policies that need to be built to reflect the U.S. workforce and U.S. families now and especially in the future, and in particular in the future, we really need to think about these comprehensive policies. Parental leave is quite important. It has, as I said, economic consequences, but it is and health consequences, but the need is much broader than that. And that's just a preview of sort of the second half of the presentation. As I said, FMLA is unpaid. And while some workers do have higher road employers that provide them some pay or allow them to cobble together some time that is paid, a lot of people can't do that. And there are significant equity consequences for that as well. And what this slide is really driving at is those equity disparities, particularly for Black and Latino families. This has real practical consequences for people's ability to put food on the table, to pay their bills, to remain financially independent if they do take the leave that they need but without pay, and it has consequences for their health and well-being and those of their family members if they're unable to take that leave. So as I said and I previewed, few workers have access to full complement of paid family and medical leave. Just 15% of working people in the United States have a designated bucket of paid family leave that they can use to care for themselves, to care for a new child or a seriously ill loved one. Less than 40% have personal medical leave through an employer-provided temporary disability program. So that means for women, sometimes the ability to take time that is fully or partially paid related to a pregnancy and recovery from childbirth, or for other workers who have a health issue, the ability to take a longer-term type of paid leave from their jobs. And more than that, even 37 million working people in the private sector don't have a single paid sick day. So that means both an absence of short-term and longer-term paid time off. As you can imagine, access to these policies varies dramatically by wage level and by job type, and those in the highest wage brackets are about 6 times more likely than those in the lowest wage brackets to have paid family leave. The same disparities are true around paid sick days, although recent successes at the state and local levels in passing paid sick days laws have started to close those gaps. But the big takeaway here is that at the end of the day, access to paid family and medical leave and paid sick days, with the exceptions of the jurisdictions that have passed laws, are really still part of the boss lottery. And whether you have access to them or not really depends on whether you've won or you've lost. And unfortunately, far too many people, and especially lower income workers, workers in communities of color, workers in service industry and care jobs have lost. This is also a gender equity issue. And that's likely obvious, but it bears repeating. So women still tend to be primary caregivers in their families. They are also often, and in some cases the majority of families, a breadwinner mom. So whether it's a married household with a woman who is bringing in a substantial portion of the income, or a single mother family, single mom family, moms are key breadwinners in the majority of families in the U.S. In Black families, it's 80% of women mothers are breadwinner moms. So this is a particular double bind where these women are providing a substantial share of their household income. They're also solely or likely to be sole providers of care. And so you can imagine not only the stress, but the real economic dire straits that these families are in. The consequences. Again, obvious, we just passed Mother's Day, so we used our Mother's Day graphic here. But moms and babies in particular are harmed by the status quo, and here thinking about new parents in particular. Few stats to sort of underscore this. Only half of first-time mothers have any or take any paid leave in connection with the birth of their child. Among moms who have less than a high school education, it's 18%, and that number didn't shift at all between 1961 and 2010, so in 50 years. Nearly 1/4 of moms, 23%, are back at work within 2 weeks of giving birth. And this isn't just a mom's issue. Often when people say paid family and medical leave, the image that pops up is moms and babies. But dads also need and want paid leave in connection with the birth of a child. And yet a full 95% of fathers are back at work within 2 weeks of a child's birth. This is starting to shift a bit, but again, the access to paid parental leave is quite variable, and it's really only high-end employers who both have good policies and encourage people to take it. And then finally, there are consequences to families and their financial independence. Nearly half of new parents with incomes of $30,000 or less said that they turned to public assistance to make ends meet when adequate paid family leave was unavailable. If you want to dig deeper into these numbers, Pew did a fantastic study last year that has some really important data around the experiences of people who have taken or needed leave. So the solutions. There are public policy solutions out there, and we'll talk a bit about the state landscape in the second part of the webinar. But just to get our terminology down, and I alluded to this a minute ago, families need access to paid time off in multiple forms. When we're talking about sort of the incidental need for leave, days or hours, we're talking about paid sick days, and there are particular policy designs that meet that need. This is time to recover from the flu, care for a sick child, seek assistance in cases of domestic violence, stalking, or sexual assault, or to get preventive care for any of the reasons that you might need for yourself or for a family member. When we're talking about paid family and medical leave, we're talking about longer term, weeks or months. That's the time that one needs to really bond with and care for a new child through birth or adoption or foster placement, recovering from a serious health issue, a surgery, helping a family member through a cancer treatment, helping an aging parent get settled in a nursing home or going into hospice, or dealing with military deployment or service member issues. And then finally, to the public health folks in particular, I'm guessing the health impacts are something that may be known to you, and Hannah's going to talk a lot more about them. But whether we're talking about economic security, whether we're talking about value to business, whether we're talking about value to taxpayers, or we're talking about health, paid leave has benefits on all of those fronts. As I mentioned, this is a gender equality issue, a gender equity issue. Personally, for families where women who have access to paid leave are more likely to stay in the workforce and earn higher wages over time, it's also an economic issue for the country. The U.S. is losing out on the value, the productivity that would be derived from women's labor if women were active in the labor force at the same rates here as they are in some other countries. For older workers, as I said, we often think about babies and moms around paid leave, but this is also an older worker issue. Our workforce is aging, our population is aging, but the number of caregivers, family caregivers, is shrinking. And that means that some older workers are leaving the workforce. When they do, they are losing out on income and retirement savings to the tune of an average of $300,000. So this is not chump change. This is serious, and it has implications for those families, for wealth and wealth accrual. Lack of paid leave factors into the racial wealth gap and the gender wealth gap. So this is a financial issue. For businesses, we often are subject to sort of this false dichotomy that what's good for workers is bad for business. But there's a growing body of evidence that actually shows that paid leave, whether provided through a public policy as it is in some states or whether through private sector initiative, actually has huge returns on investment for employers in the form of higher retention and cost savings around recruitment and hiring and training, relationship with employee morale and productivity. And for small businesses, public policies make a lot of sense. For taxpayers, decreased use in public assistance and a stronger tax base through that higher workforce participation and wages that we discussed. And then on the health side, certainly Hannah will talk about the infant and child pieces, but also faster recovery, fewer hospital readmissions, better caregiver health related to the ability to take paid leave. So that is the briefest of overviews, and I am now going to turn it back to Hannah to discuss the connections between paid leave and health equity.
All right. Thanks so much, Vicki, for those stories and for that context. I think that really kind of sets us up off to a great start. So now that we do all have that context, I will dive right into the health and health equity angle on these policies. Again, my name is Hannah Sheehy, and I'm a senior policy analyst at ChangeLab Solutions, where I'm part of an interdisciplinary team that works on creating innovative laws and policies. And you can see our mission statement here. We strive to create healthier communities for all through better laws and policies. A quick disclaimer, I am not a lawyer, I am definitely not your lawyer, and none of this is legal advice. So what does paid family leave have to do with health? In our work at ChangeLab, we spend a lot of time thinking about how to use the tools of law and policy to promote a more equitable distribution of the social determinants of health. And by that I mean the social conditions that determine who has access to the things that support a healthy life. These include housing, transportation, access to healthy food, and more. And as we began to think about policy levers we could pull to support the health of young children in particular, we started to think, is paid family leave a social determinant of health? We started to do some research, and while people in the field tend to frame it with more of an economic lens, we found that there is definitely some public health research on this topic. So we began to explore it. And while we focused on paid family leave, there are definitely implications for other types of leave, medical leave for yourself, to take care of parents. Like Vicki said, they're kind of all connected. All right, so we were able to pretty readily confirm our suspicion that paid family leave is good for infant health. Paid family leave is linked to fewer infant deaths, to improved breastfeeding, both in terms of initiating breastfeeding and the duration, so the length of time that the mom continues to breastfeed. And of course, there are well-documented health benefits of breastfeeding for babies, including reductions in the risk of middle ear infection, diarrhea, severe lower respiratory tract infections, eczema, asthma, and many more. But while we came into this work thinking about babies, in talking with people who are on the ground organizing for paid leave and for moms and babies in their communities, we learned that it's really important not to limit our focus to infants and their health, because that can play into a frame that obscures the mother and her health and the family and their health. And so we decided to do more research, and we looked at what kinds of health benefits might accrue to a mother who was able to take paid family leave. So one study reported a marginally significant relationship between duration of leave from work and new mother's physical health, which, given that it takes at least 6 weeks just to physically recover from childbirth, this is hardly surprising. And yet, as Vicki mentioned, 1 in 4 new moms is back on the job within 2 weeks of giving birth. And these are disproportionately low-income women and women of color who are going back so soon because they need their paycheck, and they are often forced to sacrifice their health to get it. Several studies also found a relationship between leave from work and postpartum depressive symptoms, where there was less risk of postpartum depression and anxiety among women who were able to take at least 12 weeks of leave. Moms who are able to breastfeed as a result of taking paid family leave also get their own suite of health benefits from that. Breastfeeding is associated with a reduced risk of breast cancer, ovarian cancer, and type 2 diabetes in moms. There's also there's evidence of a really interesting pathway from paid family leave to the health of the whole family unit that's mediated by stress. So research suggests that paid family leave can alleviate stress by providing time to manage the many, many responsibilities that go along with trying to work and have a family at the same time. And stress is a key determinant of health. It can lead to adverse outcomes like heart disease, hypertension, elevated glucose levels, which are a precursor to diabetes, and impaired reproductive functioning. Stress can also lead to unhealthy behaviors like overeating and smoking, so stress is a big deal. Paid family leave also supports families by helping to avert the strain and dissatisfaction that are often reported in marriages after a new child arrives. Strife between partners affects the mental health of the couple, and of course, if the partnership ends, that can be an even greater trauma for the whole family. Finally, we've been talking about biological families, and that's what the bulk of the literature in this area is about, but it's also worth noting that paid family leave is really important for the physical and mental health of adopted children. Adopted children are more likely to have special health care needs than biological children, and paid family leave allows parents to give those needs the attention that they really require. Paid family leave also allows adoptive parents to build a secure attachment with their child, which supports those kids' emotional regulation as they get older. So from our perspective, paid family leave is definitely a public health issue, but it is also more than that. It's also a health equity issue. And what I mean when I say health equity is essentially this. This definition is from the National Academy of Sciences. They say health equity is the state in which everyone has the opportunity to attain full health potential, and no one is disadvantaged from achieving this potential because of social position or any other socially defined circumstance. And if that seems kind of wonky to you, you might call this concept fairness or justice. You could also say it means that people get what they need to thrive and reach their full potential. You could think of it the way it's depicted here, where everyone doesn't just get a bike, they get a bike that they can actually use so that they can participate fully. I really think that having this shared understanding of the concept, including the moral dimension, is in many ways more important than sharing a word-for-word definition. Essentially, what I want to convey here is a focus on people who are excluded or underserved, and on keeping them at the forefront of policymaking so that they are able to reap all of the benefits of paid family leave, both the economic and the health benefits, instead of getting left behind. We don't want to see policies like the ones that exist at some larger corporations where people who work in offices get generous paid family leave and it's seen as a perk, and the people who clean those offices get nothing. That's not right. That's not fair. So why is this equity angle so important in this particular context? It's because evidence suggests that low-income families actually stand to gain the most from increased access to paid family leave. With low-income moms who have access to paid family leave, we see greater reductions in stress and anxiety than in study populations as a whole. We see greater increases in starting and continuing to breastfeed than in study populations as a whole. So these kinds of gains really have the potential to close inequities in maternal and child health outcomes. They are a big deal. This is a quote from a series of focus groups that were conducted in New York. The authors said that paid family leave interrupts the negative cycle of accumulated debt, dependence, poor health, depression, and despair set in motion by the loss of compensation, secure employment, or both when low-income working women have no choice but to take time off to have a baby. You can see here how paid family leave is really framed as an intervention, and I think in public health we really love to talk about interventions, and this certainly seems like something that fits the bill. This is a good spot to note that we need more research on paid family leave and health equity. The findings that I've referred to throughout this presentation are good and they're promising, and some of the studies are really methodologically strong, and of course we want to see if those results are replicable. Other studies are more limited in what we can infer from them because they have small sample sizes or limited diversity, or the assessments only happen at one point in time, like the focus groups that I just mentioned. We want to scale that research up and find ways to make it more rigorous while still maintaining that equity lens, because that's really important. And we want to see if those kinds of results still hold. So we see public health professionals as a critical cross-sector partnership to build on paid family leave. So given what we know, what makes paid family leave policy equitable or equity promoting? I'll just give a minor caveat here and say that what follows is not an exhaustive list, but rather a collection of important elements to include based on our reviews of the literature and of existing legislation. So the first one is an expansive definition of covered employers and eligible employees. So we want all employers to be covered regardless of their size. We want all employees to be eligible irrespective of whether they work part-time or full-time or are self-employed. We want to see a minimum of 12 weeks of paid leave. That's the amount of paid family leave that research suggests is necessary to maximize the health outcomes for parents and children during the pregnancy and postpartum period. And that's specifically for paid family leave. Not for all types of leave. Let's see, we want increased wage replacement and no waiting period to make it feasible for low-income employees to use paid family leave to promote their health and the health of their families. Paid leave schemes shouldn't require people to take time off without pay. That doesn't make sense. It's not what we want. Job protection to remove barriers for low-income folks and increase the likelihood that people will take paid family leave because they won't be afraid of retaliation from their employers, and an expansive definition of eligible family members, including who constitutes a parent, a spouse, and a child, to ensure that employees with non-traditional familial relationships are supported by paid family leave. So with those guideposts in mind, I'm going to hand it off to Vicki again to talk more in detail about what's going on in the policy landscape on the state and federal levels, and to tell us how we can manifest the kinds of robust and equitable paid leave policies that are going to really help us make these gains in health equity. So Vicki, I'll hand it back to you.
Great, thank you. Well, this is terrific, and the principles that Hannah just outlined, you're going to see again in thinking about what makes strong policies from a practical perspective. So this is fantastic. I think the good news here is that the topic of paid family and medical leave is on the national agenda in a way that it really has never been before. There is conversation across party lines. There's conversation in the private sector in a way that there's not been before. The media is increasingly covering this as a when issue and a what issue, and no longer as an if issue. And this is all great news. It also really reaffirms the importance of strong, comprehensive advocacy to win the strong, comprehensive policies that we need. So just sort of a primer on the landscape right now. As I said, there is unprecedented national conversation. In part, that conversation has been driven by state progress. 5 states and the District of Columbia now have paid family leave policies that have been enacted. 4 of those are actually in place. California, which was the first and has been improved upon several times since it was first passed and implemented. New Jersey, which is currently in the process of seeking expansions to a law that was passed 10 years ago this year and implemented 9 years ago this year. Rhode Island, also still seeking expansions as we're learning more about what makes good policy and trying to come back to address some of the things that were compromises on number of weeks and other things in the first place. New York, which went into effect this year. Washington, D.C., and Washington State, each of which passed in 2017 and will be implemented in 2020. One really important thing to know about that landscape, California, New Jersey, Rhode Island, and New York all had pre-existing temporary disability insurance programs at the state level that were in place. These are funded, all of these programs are funded through payroll deductions from employees, employers, or both. And the money is paid into a fund. That fund provides benefits at a certain percentage of a worker's typical wage level for a number of weeks. With temporary disability insurance plus paid family leave insurance, birth moms can take about 12 weeks, sometimes more. The family leave portion, that's the portion for non-birth parents, whether a male partner to a female or same-sex partners who have adopted, they can take between 4 and 6 weeks to care for a new child. These all also cover the care of a seriously ill family member. And the definition of family is something that has expanded in some of these laws. And that's exciting, expanded beyond FMLA, FMLA definition of just parent, spouse, or child. As I said, these 4 states, California, New Jersey, and Rhode Island, all had temporary disability insurance programs in place. They are the only states that have paid family or temporary disability insurance programs in place upon which paid family leave could be added. Washington, D.C. and Washington State are the first places that have passed laws that require a whole new infrastructure to be set up. This is a practical issue as we're thinking about state policy. It's one that can be overcome, as we see from Washington, D.C. and Washington State, but it's something to consider as we're thinking about state policy. There's a lot of interest at the state level as well. There are coalitions in place in a number of states and bills introduced in 30 or more states. And Massachusetts is the state that is most likely to pass paid family and medical leave this year, either through a legislative process, which either will or will not conclude this summer, or at the ballot in November. And it's fabulous to see. I mentioned before paid sick days. Paid sick days are a little bit more straightforward. This is employers providing an hour of paid sick time for every usually 30 or 40 hours that a worker works, up to a certain number of days a year. And this can be used for medical appointments, to recover from an illness, to take care of a sick family member, to get preventive health care for a family member, sometimes for public health emergencies, often for domestic violence. There are now paid sick time laws in 43 jurisdictions. New Jersey was the most recent and passed state paid sick time law earlier this spring. There are also laws in place in 31 cities and 2 counties. And New Jersey I will just call out because the statewide law replaces 13 municipal laws with a stronger and more inclusive standard. Often there's a lot of conversation about preemption in this space, and that's state preemption of local laws. We tend not to want local laws to be preempted, and so that is something to be on the lookout for. There's also preemption around the ability of localities to pass something in the first place, even when there is no state law on the horizon. And that's something in particular that public health advocates across a range of issues have worked very hard to push back on. Public health advocates, civil rights advocates, environmental advocates, and LGBTQ advocates. Preemption is something we see often. The good news is we now have these paid sick days laws across the country. They have contributed to tens of millions of workers earning paid sick time. And that's good news. As I said in the beginning of the presentation, it started to close the gaps between higher and lower wage workers because the laws have spurred coverage for lower wage workers that didn't have it before. We are excited to see more progress there. There's a ballot campaign in Michigan that is underway with signature collection, as well as some others in Texas. And all of this state momentum is great. As I said, it is also leading the way to federal progress. At the federal level, there are strong bills for paid family and medical leave and paid sick days. There's also starting to be a lot of conversation about proposals that might check the box, that sound good, but actually would do more harm than good. And this is part of the reason that we at the National Partnership, our coalition partners across the country, the folks that you'll have access to during the experts panel, are all working very hard to build strong, robust grassroots movements to advocate for strong, inclusive, and comprehensive policies that promote equity. And to say that checking a box or using words around flexibility or being there for families is not enough. We really need to think about the policy details to structure strong, sustainable, inclusive, comprehensive plans that meet the needs of families today and in the future. And we can't be fooled by proposals that have good words in the title but would do more harm than good. A few things to be on the lookout for here are proposals around comp time, for example. So fake flexibility legislation, using the words flexibility for things that will actually take wages away from workers without guaranteeing them time. A proposal called the Working Families Flexibility Act, or comp time, proposal to allow employers and employees to use comp time instead of wages for workers who work more than 40 hours a week and are paid hourly. Passed the House last year. We don't expect for it to pass the Senate. But the language, the ability for parents to take time to go to a ball game, the ability to take time to care, same language, very different policy than guaranteeing workers access to paid sick time that they have earned. There's a proposal that is gaining some traction right now that would actually undermine all of the state and local paid sick days laws that have passed by giving large employers, multi-state employers, the ability to opt out of complying with that paid sick time legislation. Would also affect FMLA, would also affect scheduling laws. If folks are interested in getting more involved in this particular fight, please contact us, and we're happy to plug you into those defense efforts. On paid family leave, we're seeing exclusionary legislation again that checks a box but actually exacerbates inequality rather than narrowing those gaps where we're really a nation of have and have-nots subject to the boss lottery. Employer tax credits. This is a policy that was piloted actually and passed as part of the tax proposal last winter. This is a pilot program that would provide very small tax credits for potentially very paltry paid family leave to employers who voluntarily choose to provide it. Conservatives and progressive economists who have looked at this proposal essentially agree that this is not going to increase access to paid leave. Savings accounts. And I don't know if folks saw the new research today out of the United Way, but it just really reaffirms how many families are living paycheck to paycheck, are very close to poverty, don't have extra income. Savings accounts that basically are tax-deferred shelters for people wanting to save for their own leave are not going to be workable solutions for the folks who don't have access to paid leave now. Targeted means-tested benefits that are subject to annual appropriations are going to run into the same problems as we see with other safety net programs, and don't provide the certainty that either families or their employers need to understand how families are going to be able to take care of themselves when a serious family or medical need leave arises. Parental leave only legislation, and this is one that I really want to spend a little bit more time on because it sounds good. We are the only developed country that doesn't have paid maternity leave. We're one of a handful that doesn't have paid paternity or parental leave. And so there is a temptation to say that any proposal that provides paid leave to new parents is better than nothing. But there are two proposals out there that even on their face are problematic. They would erode programs like Social Security or unemployment insurance. They don't provide new revenue in a way that is at all, and that's unsustainable. And they provide benefits that would be too low in terms of wage replacement for even new parents to be able to afford, much less excluding the 75% of workers who need FMLA leave for something else. And then finally, moms-only policies. And again, we talk about paid leave, we think of moms and babies. But policies that treat women differently are very problematic for women's employment, for discrimination, and also for continuing to perpetuate stereotypes and norms around moms as caregivers, and really taking away from men the ability to provide care for their families. And then finally, irresponsible legislation, again, related to the parental leave only proposals that we're seeing. And the risk of this, the fact that this is being discussed, that organized business groups are now saying they know that paid leave is coming and they need to figure out what their position is. This means that it's time to double down on grassroots organized efforts in states and oriented towards federal policy as well as state policy that are making the case for strong comprehensive legislation at the national level. The moment is ripe. The gender equity conversations that are happening, the economic equity conversations that are happening, the fear of business groups that the state patchwork is only going to make their lives more complicated, what they would call a state patchwork is going to make their lives more complicated. It's creating real energy around a possible comprehensive national paid family and medical leave solution. And so I'm going to wrap up here again with a version of the key principles that Hannah outlined. These are checklists that the National Partnership developed. They're principles that a lot of the paid leave movement across the country embraces. And again, what we're looking for here in national legislation as well as in state legislation is a plan that is affordable and sustainable, inclusive, provides a substantial amount of leave with adequate wage replacement, is comprehensive as to the full range of personal, medical, and family caregiving needs, doesn't try to pit new parents against other folks who need access to leave, and that is secure so that you're not retaliated against or face adverse consequences on your job for taking leave, which is a barrier to access and certainly a barrier for lower wage workers and workers without any real power in their workplace. So I'm going to wrap up here and turn it back to Hannah to conclude. Oh, no, I'm not actually. Sorry. I'm going to just once again, implore that you are central to this. Demographics, the national dialogue, state success, private sector leadership, huge bipartisan public support and a growing demand, research that underscores both the need and the benefits of policy, and a growing sense in the media and among other stakeholders that the time is right for paid leave makes this a moment, and you are an essential ingredient for success. So now I'm going to conclude and turn it back to Hannah.
Great. Thank you so much, Vicki. It was great to kind of get the whole picture, and we hope that throughout the presentation we've given everyone some ideas about how paid family leave intersects with your work and with public health, and what kind of bridges you want to build in your communities. So if you have questions, like we were saying before, you can add them to the Q&A box now. The Q&A box will be open until the end of the webinar. After the webinar is over, you can also email questions to me or to Sophia, and you'll see our contact information at the end. You can also ask them in real time at our expert panel, continued conversation about healthy children and families, which you can register for on the series homepage. The next episode, episode 3 of the series, will be launching shortly on June 4th. It will explore the intersection of food and procurement strategies as drivers of health equity. If you're looking for resources on this topic, ChangeLab Solutions created a literature review, a fact sheet, and an infographic on paid family leave and health equity, which you can find on our website. I would encourage you to check those out. They will also be linked on the episode archive page after this webinar is over. And finally, stay tuned for the Blueprint for Collective Action, a guide we will be releasing at the end of this series that focuses on how communities can address health inequities. And if you don't happen to see what you're looking for, feel free to reach out to us for technical assistance. We may be able to help you. So here is our contact information. As soon as this webinar ends, you'll be directed to a very quick follow-up survey, just a couple of minutes. Please take 2 or 3 minutes to share your feedback with us and help us shape this conversation. Your input is really important. A recording of this webinar will be available soon. You'll receive a follow-up email about that. And to close, thank everyone so much for joining us today. We hope to see you on Tuesday for our expert panel of equity innovators, including Kimberly Bug, Sharon Turman, Sherry Lawant, and Yvette Sanchez-Fuentes. And I'll leave you all with that. Thanks.